We are facing a mental health crisis in this country, and that's due to the past decade. Our mental health services have faced chronic and shameful underfunding by this government.
We're seeing real kind of increases in self-harm and mental health problems in teenagers at the moment, and I think a lot of that is the pressure that children are put under at school.
You can't understand the changes in people's mental health and well-being without looking at the wider context that people are living through at the moment.
The real hypocrisy of this government is in the fact that whilst they're claiming that they want to address mental illness, they are knowingly implementing policies which are detrimental to people's mental health and their well-being.
To me, the government is the kind of problem, as in they cut something and they keep cutting and then it gets worse and then they put money back into it, but then it's not going to the right places that need it.
We see more and more people going to A&Es with mental health issues, more police time is getting taken up trying to support people with mental health issues. Number of people being detained under the Mental Health Act is increasing. I think it's increased by 47% over the past decade. So that's people getting sectioned because their mental health is getting so bad because we're not supporting them in the communities.
You cannot get away from the fact that we're 100,000 staff short across the NHS. And that means that the remaining staff are really struggling to provide good quality care. And they're often the ones that are blamed if something goes wrong, even though it's not their fault, because you cannot be in two places at once.
Some staff members that just feel like they want to pull their hair out because they can't keep up with the workload.
The waiting list to see a specialist mental health support is getting appallingly long. So I have patients who can be waiting months, sometimes up to a year.
I've seen people in tears at work because they know that something bad has happened to a family while they've been on a waiting list, and they immediately feel responsible.
People are not getting seen, and then that's making, if they have been on the wait list for 6 months, they're probably going to end up in a crisis and end up going to A&E.
They've closed over 8,000 mental health beds, and that's 32% of NHS beds in total. And the result of that is that when a person needs an admission to hospital now, they are more likely than not to be sent to a private hospital, and there's money hemorrhaging from the NHS into the coffers of private hospitals.
I used to work in a mental health ward, and I remember on my first day we had a mother admitted, and she was like hours away from her family, and it was so sad. And it's because in her area the mental health hospitals didn't have any space.
I'm going to our local news, our local BBC, and I'm going to have to speak out against this. She's got anorexia and you're telling me she can't have a specialist bed. Within an hour of that happening, the Commissioner sent a message via our therapist, our care coordinator, that she could have the bed, and would I please not go to the media, could I be talked out of it? By which time it was too late. I'd done that and it had served its purpose. We'd got a bed, but the bed, it wasn't the hospital she originally went to. It wasn't going to offer her continuity. It was 300 miles away from our home. And here were we celebrating that. That's how bad it was, that we were so desperate and so grateful for a bed. We thought 300 miles away was going to be all right.
So if you want a healthy and educated workforce, and a workforce whose disabled, elderly or children can be looked after by publicly provided social care and don't have to give up their job to look after their dependents, then it makes complete sense to invest in good public services.
I think we need to make a decision as a society. Do we want to support people and allow people to live healthy and happy lives, or do we want a society that fails to look after those that are struggling, the most vulnerable in a society, and allows them allows their health to deteriorate and allows them to go down a spiral of poverty, and that's just not the society that I want to live in.
I don't want to be sceptical. I want to believe that it's going to improve, but I'm only going to believe it when I see it. And campaigners like me and many other people are going to hold the government to account, stay vigilant, watch what's going on, and tell the truth about what's really happening.